I worked for many years with Dr. Soma in Eurasian Federation of Oncology, and I organized those meetings for specialists, for doctors in different areas of oncology. Well, but then we realized that we should pay more attention to our patients, to support them, and which we don't do in Russia, we decided to separate this activity, and we founded Eurasian Cancer Foundation to do this. So Eurasian Cancer Foundation, it deals more with patients and more with young specialists, and also with areas of oncology which has social importance. For example, I think that's palliative care, that is supportive care, and communication skills, and also I think pathology as a foundation of all oncology, and as a main thing which has to be right done for the patient to get a right treatment. So that will be what we'll do. We have special activities for patients which are art therapy and psychological courses and support. We have recently collaborated with Jens Sayan and Natalie Stott, which is astronaut, which is NASA's astronaut. She used to be. So they had a program for a patient in MD Anderson Oncology Center. So they painted special material with children who had cancer. They painted triangles with what they thought to be right, and then they sewed a suit for astronaut, and they spread this to Russia and Japan and Germany and Canada. So, and we here in Russia, we supported them in this activity. So that is, one example of what we can do for our patients, and also master classes and everything for them not to be isolated, because that is really important. They can fight with cancer for 1, 2, 3, 5, 10 years, and in Russia they're isolated because they don't work. They can't work sometimes, not always, but sometimes they can't work, and they go to hospital and they stay in their room. That's all. That's all they do, and that is, they're like they're dead, but they're not. So we should support them in it, and also we should. I think we should pay more attention to the education of our young specialists and of our students, because we have. I think we have really. Our doctors are not well educated in oncology because they have only 2 weeks of oncology course in 6th grade, and that is not enough. We made a basic course of oncology for our students and young specialists, and that is on competitive basis, but we choose about 40 students and young specialists which are not oncologists actually, because that is also really important to educate specialists which are therapists or any specialty, because they also sometimes see oncology and they need to know what it is. So we choose 40 specialists and young specialists and students, and we invite more than 30 or 40 sometimes specialists which are leaders in their area of oncology, and they give talks and lectures. They live with students for 10 days, and they speak to them, they communicate, and that is really good. That is a special course for us.